Cardiovascular disease remains a primary driver of mortality worldwide. In Japan, where the impact of hypertension on heart health is particularly severe, understanding your actual baseline is a critical requirement for long-term survival. Most of us are familiar with the standard clinical routine. A nurse cinches the cuff, the machine hums, and a few moments later you have a set of numbers that ostensibly define your health. It is easy to view this single clinical encounter as the definitive truth, a conclusive health baseline recorded in a professional setting. In reality, a clinic visit is a brief, isolated snapshot. These numbers reflect your body's state during one specific moment, in an environment far removed from your actual life. Blood pressure is a moving target. It shifts from a morning commute, a difficult conversation, or the quality of your sleep, fluctuating significantly throughout every 24-hour cycle. Relying on a single, potentially skewed clinical data point leaves massive gaps in your medical profile, allowing significant cardiovascular risks to persist entirely undetected between doctor visits. The medical environment itself often introduces data anomalies. One of the most common is white coat hypertension, where the setting of a clinic directly interferes with the accuracy of the reading. For many, the inherent stress of a medical facility triggers a physiological spike. This psychological hospital effect can drive blood pressure higher than it would ever be in a familiar, comfortable setting. While these spikes are temporary, recent clinical research suggests they are not benign. Patients who react this way in the clinic often show an increased long-term risk for heart disease compared to those with consistently normal readings. This comparison highlights an even more deceptive glitch: masked hypertension. Within this shaded zone, a patient shows healthy numbers in the doctor's office, while their actual daily life is characterized by dangerously high pressure that the clinical visit fails to capture. This hidden risk is particularly prevalent among younger demographics. Because they may appear healthy in a brief exam, these invisible surges can inflict years of cumulative damage before a problem is ever diagnosed. When diagnostic data is restricted to clinical visits, it creates a blind spot. This leaves a high probability that the most dangerous fluctuations will occur exactly where your doctor cannot see them, in the middle of your normal day. Establishing a consistent home monitoring routine provides the continuous data stream necessary to see past these clinical glitches. Capturing accurate home data requires a strict protocol. You must achieve complete physical and mental rest to ensure the machine records a true baseline. Preparations begin 30 minutes before the measurement. During this window, you must completely avoid caffeine, alcohol, and smoking, as these substances cause immediate, artificial spikes. Positioning is equally critical. You need 5 minutes of quiet sitting before the test, with your arms supported and kept perfectly level with your heart during the entire process. It is common for patients to feel discouraged if they see a single high number on their home monitor. However, the goal of home monitoring is not to obsess over one reading, but to gather a high volume of data to calculate a reliable long-term average. Following this procedural checklist filters out environmental noise. It converts a series of random numbers into an actionable map of your heart's true performance over weeks and months. By aggregating daily home readings, you eliminate the data gaps and diagnostic blind spots that clinic-only testing inherently creates. Doctors can then use this comprehensive data stream to develop more precise, effective treatment plans tailored to how your body actually functions in the real world. This approach also changes your relationship with your health. Monitoring your own trends at home places the responsibility and the tools for management directly into your own hands. Seeing how lifestyle choices immediately impact your numbers serves as a powerful motivator, often leading to more consistent improvements in diet and exercise habits. These 4 rules ensure your data is clean: no stimulants for 30 minutes, 5 minutes of quiet rest, arm level with the heart, and focusing on the long-term average. Tracking these metrics daily provides the specific, ongoing insight needed to identify risks early and take control of your cardiovascular future.